you're feeling?
Yes. I'm feeling really pleased that I can, that I'm getting towards being able to play the clarinet again. It's there's a period of programming that has to take place after the operation. So after the recovery period, gradually getting more and more stimulation, and that I can see that when I try to play the clarinet, it's gradually getting better.
Denise, watching those incredible pictures, can you describe to us what that felt like for you?
It was just amazing to see and feel my fingers moving better and faster and sort of flowing more.
How difficult was it to play before you had the surgery, Denise?
It had become very difficult. I used to play in the East Grinstead concert band, which I really enjoyed for quite a few years. And I had to stop around about lockdown, I remember, because I just couldn't keep going. And it was mainly because the fingers weren't pressing, I couldn't press them accurately on the holes and the keys. And as the air escapes, so it squeaks and everything just falls apart.
So Denise, at that point, had you assumed that maybe your playing days were gone for good?
Yes, definitely.
Professor Karamars, good morning to you too as well. I mean, this is just so remarkable to see that transformation almost instantly. Just talk us through that process. What is involved, if you will, and are results like that so quickly common?
Good morning to you and to your audience. So the operation we did for Denise is called deep brain stimulation, which is a process whereby to insert really fine wires, order of 1.2 millimeter in diameter, so really thin wires, into the brain, into particular nuclei deep inside the brain, which are responsible for control of movements. And for example, in Parkinson's disease, which is a condition that Denise had, the main issues are problem with muscle control. You get stiffness of the muscles, slowness of the movements, tremor. And I can imagine when you're trying to play a clarinet or a musical instrument, all those various factors affecting your muscles will impair and do not let you get on and play the instrument that you love. So we did the operation, we tend to do these operations awake, so we can assess the patient on the table. And typically when we do these operations, we look for speed of movements, stiffness getting better, and also the tremor going away during the surgery. But of course, in Denise's case, that wasn't enough for her to give her quality of life back. What she wanted, she had some clear goals. One of them was being able to go back and play the clarinet. So obviously we thought that the best way to assess that would be to have her awake during the operation playing the clarinet, so we could test her finger movements and the speed of the movements and make sure that they are no longer stiff, they can do what she wants from them to do. And therefore we did this operation awake. She played continuously, and we were able to fine-tune the position of the electrode deep inside her brain until she was able to play the beloved musical instrument. And that's where we knew that we actually hit the sweet spot in the brain.
And Professor, what's it like for you and the team when you hit that moment where you know you're doing the right thing?
Well, it's a moment of joy. It's a moment of being really elated, because all we do is to give the best that we can possibly do and give to our patients. And, you know, medicine is very personalized. Quality of life is very personalized. And, you know, you got to listen to your patient and find out what it is they want from the treatment. And they often differ between a patient A and patient B. So the first step is to understand what are the goals. And then when you know the goals and when you plan a treatment to reach those goals, and then when you see those goals achieved on the table, real time in front of your eyes, instantaneously, that's the moment of pure happiness and pleasure for the patients, because we managed to do the job correctly.
Denise, did you play anything particular when you were there in the operating theatre? Is there anything particularly played? And might I maybe ask you if it's okay to play us a little bit this morning?
I didn't play anything in particular. I just sort of scales and things. I haven't played for a long time, so I'm not really that keen on playing.
That's absolutely fine. I know, and you talked there as well about some programming that needs to be done as well. So maybe let me ask you, Professor. You know, Denise was saying there's some programming that needs doing. What does that actually mean?
Absolutely. So on the table, we put electrodes. We do instantaneous testing of the system because we want to make sure that we are achieving what we intended to do.